It was 1978, in a public hospital in Lusaka, Zambia. Fatina Mutombo held her newborn son for the very first time. He was her first child. Her husband was a day laborer, bringing home less than $20 a month. The room was cramped and worn down, but Fatina was happy. Then a woman in a white coat walked through the door. She smiled and held out a small can. "This is far better than breast milk. Your baby will grow up so much stronger. All the mothers in developed countries use this." Fatina didn't hesitate. This woman looked like a medical professional. Why would she lie? And it was free. Back home, Fatina followed the instructions on the can and mixed up a bottle. But there was no clean water. She had no choice but to use water drawn from the village well. That water was teeming with bacteria. By the time the sample ran out, Fatina's breast milk was gone. Feeding formula had caused her body to stop producing milk entirely. She had to scrape together whatever money she could to keep buying formula. When money ran short, she stretched it by adding more water. Her son died 3 months after he was born. The cause of death was severe malnutrition and infectious diarrhea. The hospital doctor never explained a thing to her. It was years before Fatina learned the truth. The woman in the white coat was not a nurse. She was a Nestlé sales rep. Fatina's story was not unique. At the same time, millions of mothers across Africa and Asia were going through the exact same thing. And millions of babies lost their lives for the exact same reason. Nestlé was founded in Switzerland in 1866. The very first product its founder, Henri Nestlé, created was an infant food formula. From day one, baby formula was at the core of Nestlé's business. By the 1960s, the market in wealthy countries had hit a wall. Falling birth rates meant the formula market in Europe and the United States had stopped growing. Nestlé needed a new market. That's when Africa, Asia, and Latin America came into focus. These regions had skyrocketing birth rates. Populations were growing fast, and the desire for modernization was everywhere. And crucially, almost every mother was breastfeeding. Nestlé's executives saw that as a problem. A mother who breastfeeds doesn't buy formula. In other words, stopping breastfeeding meant creating a market. In the early 1970s, internal Nestlé reports contained analyses like this. Women in developing countries strongly aspire to the lifestyle of wealthy nations. Position formula as the symbol of modern, scientific parenting. That strategy would go on to cost millions of lives over the next several decades. Nestlé dressed its sales reps to look like nurses. White coats, stethoscopes around the neck. Nestlé called them milk nurses, infant care specialists. These reps walked straight into maternity wards. They targeted mothers in their most vulnerable moments, right after giving birth. When someone who looks like a healthcare professional recommends a product, you don't question it. In some hospitals, these sales reps actually made rounds alongside real nurses. The hospitals received what Nestlé called donations. The free samples handed out right after birth were anything but a gift. The human body operates on a precise feedback system. The more a baby nurses, the more milk the mother produces. Feed a baby formula, and the baby nurses less. The mother's body reads that as a signal and cuts milk production. Within just 2 to 3 weeks, her milk supply is nearly gone. And that's exactly when the free sample ran out. Now the mother has no choice. No breast milk. A crying baby. She has to buy formula. Nestlé knew exactly how this biological mechanism worked. The cost of feeding a baby proper amounts of formula was steep. In Zambia, Nigeria, India, and elsewhere, a single can of formula often cost as much as a full day's wages. Feeding a baby the recommended daily amount could swallow up 30 to 50% of a family's entire income. There was no way to sustain that. So mothers started watering down the formula. Half the recommended amount, sometimes a third, more water to fill the rest. And that water was contaminated. These three traps didn't operate in isolation. Each one was engineered to lead directly into the next. Breast milk contains something no formula can ever replicate: antibodies. A mother's milk is loaded with immunoglobulins, the building blocks of a newborn's immune system. Colostrum, the milk produced right after birth, is so packed with immune compounds it's often called liquid gold. Formula has none of it. So what does it mean when a newborn with virtually no immune system drinks diluted formula mixed with contaminated water? It means bacteria go straight into that baby's gut. Diarrhea sets in. Severe diarrhea leads to dehydration. Dehydration, combined with malnutrition, wipes out what little immunity remains. At that point, any infection becomes fatal. The healthcare systems across Africa and Asia at the time were completely overwhelmed. Hospitals were scarce. Doctors were even scarcer. Parents had no idea what to do when their child got sick. British pediatrician Derek Jelliff investigated hundreds of infant deaths in Ghana in 1973. His findings were devastating. Babies who were not breastfed were dying at a rate 25 times higher than those who were. This wasn't just a matter of formula being slightly inferior to breast milk. In that environment, formula was essentially poison. The numbers researchers published in the mid-1970s are still hard to believe. More than 1 million infants were dying every year from causes directly tied to this crisis. That's 2,700 babies a day, 112 every hour. At the height of Nestlé's marketing push, almost 2 babies were dying every single minute. There were people inside Nestlé who knew. As far back as the 1960s, some employees raised concerns about the company's marketing practices in developing countries. Every one of those concerns was shut down. Nestlé's cover-up operated on multiple levels. Nestlé made a habit of giving money and supplies to local hospitals and medical staff. It donated equipment and sponsored training programs for healthcare workers. In return, hospitals allowed Nestlé's sales reps to roam the wards. Some doctors were trained to recommend formula as if it were a medical prescription. From a parent's perspective, if your doctor recommends it, you don't question it. Nestlé also worked to influence government officials in developing countries. Whenever there were moves to regulate formula marketing, Nestlé pushed back hard. In some countries, nutrition research funded by formula companies was directly incorporated into official government policy. Nestlé funded studies specifically designed to produce favorable results. Studies concluding that formula was safe, or even equivalent to breast milk. These studies got published in academic journals and shaped the opinions of healthcare professionals. It was an early blueprint for what the pharmaceutical industry would later perfect: sponsored research bias. January 1974, London. An NGO called War on Want published a pamphlet. The title was 3 words: The Baby Killer. This 28-page report laid out in concrete detail the marketing practices of Nestlé and other formula companies. The white coat sales reps, what they actually did. The cozy relationships with hospitals. How the free samples destroyed mothers' ability to breastfeed. How contaminated water and watered-down formula was killing babies. It was all in there. At first, the report circulated only in Britain. Then, a Swiss activist group, the Arbeitsgruppe Dritte Welt, translated it into German. The title of the German version was even more direct: Nestlé kills babies. Once the German edition spread across Switzerland, criticism started pouring in from the very country where Nestlé calls home. Nestlé moved fast. But it wasn't an apology. In 1974, Nestlé filed criminal defamation charges against the Swiss activist group. It would go down as one of the most boneheaded decisions in the company's history. The trial dragged on for 3 years. For 3 years, the global press covered it constantly. Every court date drew crowds of activists outside the courthouse. With each news report, more people around the world learned about the formula scandal. If Nestlé had never filed that lawsuit, this whole story might have stayed a small Swiss activist issue and nothing more. In 1976, the verdict came down. The court handed the activist group a minor fine. On the surface, it looked like a win for Nestlé. But anyone who actually read the ruling saw something very different. The judge wrote in his opinion, while the defendant's language went too far, Nestlé must fundamentally reconsider its marketing practices in the third world. Nestlé's conduct has been immoral and unethical. Nestlé won the case, and the judge still called them immoral. That line ran in major newspapers around the world. The Nestlé formula scandal was now a global story. After the trial, the international pressure on Nestlé intensified dramatically. UNICEF, the WHO, governments, and consumer groups all started speaking up. 1977, Minneapolis, Minnesota. Local religious groups and community organizations gathered and issued a declaration. Starting today, we will not buy Nestlé products. That was the spark. The boycott spread like wildfire. Churches, universities, labor unions, and women's groups across the U.S. joined in. It spread to Europe, then to Canada, Australia, and New Zealand. Ultimately, 70 countries were running boycotts simultaneously. Every product Nestlé made was fair game. Nescafé, Kit Kat, Maggi noodles, Nesquik, Milo. People started picking up these products in supermarkets, then putting them back on the shelf. Asking for anything but Nescafé became a normal thing to say at a cafe. Nestlé held its ground at first. The company figured the boycott would fizzle out. It lasted more than 7 years. Nestlé's sales started taking a real hit. Shareholders began putting serious pressure on management. What made this boycott unusual was that religious institutions were at its core. The Presbyterian Church, the Methodist Church, Unitarian Universalists, dozens of denominations officially signed on. Some pastors preached about the Nestlé boycott from the pulpit. Buying products from a company that kills babies is a sin. This was no longer just a consumer movement. It had become a moral one. 1979, Geneva. The World Health Organization and UNICEF called an emergency joint meeting. The agenda had one item: how do we regulate formula marketing? After 2 years of debate, a landmark document was adopted in 1981, the International Code of Marketing of Breast Milk Substitutes, known simply as the WHO Code. The core provisions of the WHO Code were straightforward. No advertising or promotion of formula inside healthcare facilities. No free samples or gifts given directly to consumers. No using healthcare workers to promote formula. Product labels must state that breastfeeding is the best option. No advertising that portrays formula as superior to breast milk. The World Health Assembly vote was 118 to 1. 118 countries in favor, 3 abstentions, 1 against. The one country that voted no was the United States. The Reagan administration argued the code interfered with free enterprise. It was also the result of heavy Nestlé lobbying. Nestlé publicly announced it would comply with the WHO Code. The boycott was officially suspended in 1984. But the story doesn't end there. It's been more than 40 years since the WHO Code was adopted. Yet watchdog organizations publish the same report every single year. Nestlé is still violating the WHO Code. In February 2023, the British newspaper The Guardian dropped a bombshell investigation. Nestlé was adding sugar and honey to baby formula sold exclusively in lower-income countries. The same products sold in Switzerland, the UK, and Germany contain no added sugar. But versions sold in poor countries across Africa, Asia, and Latin America? Loaded with added sugar. Babies exposed to sweetened formula early on develop a preference for sweet flavors. As they grow up, they keep reaching for those products. Nestlé was engineering lifelong customers. According to a 2022 report by the International Baby Food Action Network, Nestlé and other formula companies were still running hospital marketing campaigns in 24 countries across Southeast Asia and Africa. The methods have just gotten more sophisticated. Instead of direct promotion, they sponsor hospital educational materials and fund medical conferences. The core playbook is identical to what it was 40 years ago. To this day, Nestlé has never faced criminal prosecution over the formula scandal. There have been civil settlements, but not a single individual executive has ever been held personally responsible. Hundreds of thousands, possibly millions, of babies died. Nobody went to prison. The Nestlé formula scandal isn't just a story about one greedy company. To understand how this was possible and why no one was ever punished, you have to look at the system. Nestlé is headquartered in Switzerland and operates everywhere. When an African baby dies, that harm occurs in Zambia. Zambia had neither the capacity nor the political leverage to prosecute Nestlé. Switzerland was not about to hold its own company accountable for what happened overseas. Nestlé exploited that legal gap perfectly. Mothers like Fatina had no way to verify the information they were given. Literacy rates were low. Independent media didn't exist. In a world where you have no choice but to trust medical professionals, questioning what they recommend is nearly impossible. Poverty itself was the condition that made the exploitation possible. The WHO code is an international standard, but it's not legally binding. It's a recommendation. Turning it into enforceable law is up to each individual country. And many countries, thanks to Nestlé's lobbying, never properly enacted it. The result, Nestlé can publicly commit to following the WHO code while facing essentially zero consequences for breaking it. It's been over 40 years since Fatina Mutombo's son died. She still lives in Zambia. If her son had lived, he would be in his mid-40s today. Nestlé's annual revenue in 2023 was approximately $100 billion. It is one of the largest food companies on the planet. Not a single executive has ever faced criminal charges over the formula scandal. Today, we still buy Nestlé products. We grab a Kit Kat at the checkout counter. We order a Nescafé at the coffee shop. We toss a pack of Maggi noodles into the cart. This isn't about telling you what to buy or not buy. It's about knowing the history behind the companies we support with our money. There's a difference between choosing something with full knowledge and choosing it in ignorance. And more importantly, this story isn't over. Right now, somewhere in the world, a sales rep in a white coat is handing a can of formula to a new mother. Right now, somewhere in the world, a mother is mixing formula with contaminated water. Right now, that baby is in danger. Knowing this story is the smallest possible first step towards saving that child. Thank you. See you in the next story.